Hey everyone, thank you for coming to check out my video, Face and Neck Sculpting Foundations from Structure to Lymphatics. We're going to be talking about some really cool things in this presentation today, things that I feel like a lot of people don't normally think about when it comes to these things. And today we're mostly going to be focusing on the chin and neck area for people who have maybe a double chin, or maybe they want to just firm up their jawline or make it so they have a more sculpted neckline. These are all the things that we're going to be talking about in this video today. So in this video, we're going to be talking about the importance of self-assessment, the lymphatic system overview, fascia and its role in the body, the musculoskeletal system, and how structure and function work together, because even though we're talking about the head and neck, we want to make sure that we address structure and function of the whole body and how that plays into that area of the body. And this is me. This is my before and after pictures. I've incorporated a lot of these things myself. This change happened in just under 2 months, and I had no other weight loss. So you can see the difference that it made in my skin, in my complexion, in my in how my face shape and all of that. So pretty cool information, and I am excited to share this with everybody. So first off, we have the importance of self-assessment. Before beginning any sort of program, it's important that you decide where you're at now. If you don't know where you're at, you won't know where you got to after a period of time. And if you incorporate anything new, it's just important. And also, it's very fulfilling to be able to see how far that you have gotten in your progress. And I will tell you, with those first pictures that you just saw on the previous slide, I actually didn't think that I had any changes. You can see there are a lot of changes that happened. So things that happen over a period of time do need to be, often pictures will help with knowing what changes have been made. Okay, so definitely for sure, since we're talking about the head and neck, we want to take a side view, a direct side view picture of both sides of the face, and we also need a front on view. And I would recommend that you take pictures maybe like midway up the chest. Don't just take head and neck pictures, so that you can sort of see how everything ties together. You can always zoom in and crop and whatever, but the pro tip is this is to put your phone on a stand and increase the zoom 2 times. That helps to prevent distortions in your pictures. Cell phones are made to make you look skinnier and have wide angle lenses, whatnot. So you don't really get a true picture of how that is, and you definitely don't want it to be on selfie mode. So that's very important. Again, more pictures of myself and actually my son. This is our pictures, some of the pictures that we started out with, some of our progress pictures. And so you can kind of see what I'm talking about with the view of each of the pictures. You want 2 side pictures and 1 front-on picture. And also, I think it's very important to take pictures of the mouth and tongue. It might sound weird, but initially it will make sense here in a minute. But it's important to know where you're at with the mouth and the tongue. That plays into the chin and jawline and neck and the structure and function of the whole body. So we want to be able to see that. So there's 3 different views that I would recommend. First, you want to smile wide and take a picture of your bite. Second, you want to open your mouth as comfortably wide as you can, and you want to stick your tongue towards the roof of your mouth. This is for 2 reasons. You want to see if you can touch the roof of your mouth with your tongue. We want to be able to see what's under the tongue, and also we're looking for tongue ties, quite frankly. That will play into the into this, and you'll see why. And then you also want to see if you can actually suction your whole entire tongue to the roof of your mouth. You want to open as wide as you can. If you cannot do this, then that is a symptom of something important to be addressed. And also, if you can't open very wide or you can't suction very strongly, those are all important things to know. And again, this is optional, but I would still recommend taking full body views, same as the other pictures. You want to be able to have front and both side pictures, and I'll show you here in a minute why that is, what we're looking for. Okay, so there are some different chin types, and if you want to tighten up your chin and you know, have that chiseled jawline, you got to know what type of chin you have. There are people who have a great chin type, great structure and function, and this video is not for those people. And for the people watching, it's probably because you have something going on and you want to take a look and learn more about that. So the first type is the lymphatic type. You can know if you have this chin type if you have like a puffy fat pad located under your jaw. This can go down the neck. It can just be directly under the chin. It's often accompanied by a puffy face, but there are skinny people who still have kind of this double chin look that is totally still the same. This can be exaggerated by poor posture and also tension, but also there could be multi-factors in this. Just because there are a few different types that we're going to be talking about doesn't mean you're just one of those. You could be multiple of those chin types. So this is the lymphatic type. We'll talk about why we call it that. The next type is the low tongue posture type. This is me in the pictures. You can see the difference in the pictures from when I purposefully have my tongue sitting low in my throat versus when it's sitting up high towards the palate. And you can see the difference it makes in the chin. Again, or the neckline, and we will talk about kind of the details of that. And then the other is a forward head posture type. This is a lot of people have poor head posture that plays into the body structure. It can create a whole host of issues, and poor head posture doesn't always originate in the head. Sometimes it originates at the feet or the pelvis. Again, we will talk about all these different types, and you'll see what I'm talking about. And then there's also a structural or biomechanical type, and this is more like the top to bottom structural assessment. Again, this plays into the previous slide, but yes, like all of these pictures are exaggerated in this slide, but you can kind of get the idea of what I'm talking about. Okay, so you may have identified what chin types you are, and if you haven't, you can take pictures and assess, and I am also willing to help people do those assessments. I offer consultations online, and so I am available for that, or another professional is available for that, but we're going to get into which chin types and maybe some things that you can do about what chin type you are. Okay, so let's say you're a lymphatic chin type. You have that puffy fat pad under your chin. You know, in that picture on the left, that gal's pinching it. Usually if you sort of pinch under there, it really shouldn't feel firm and thick. You know, if you just have skin under there and you don't have any of that fat pad under there, it would not feel the same. And then obviously from a side profile, you might be able to see that. Okay, so the lymphatic system, we need to talk about that for a minute. For those of you who don't know what this is, the lymphatic system is a network of vessels and nodes and tissues located through the body. It helps move fluid, remove waste, and support immune function. It is actually one of the biggest parts of your immune system. It works by collecting excess fluid, toxins, and cellular debris from tissues and transporting them through lymph vessels to lymph nodes, where they are filtered before returning clean fluid back into circulation. It is a large part of your immune system. Well, let's go on to the next slide before I cover any more. When the lymphatic system can't work optimally, fluid and toxins get backed up and can deposit themselves into tissues. So that little fat pocket right under your chin is what we're talking about, but also cellulite and even just general puffiness. The lymphatic system has no pump like the heart to make it work. It uses body movements as the pump. So this means that this is one of the reasons why we need to be mobile and move, because our garbage system actually needs our muscles pumping. There's some more things that sort of play into the lymphatic system and its ability to be able to work properly. Interestingly, individuals who have green and blue eyes are also more likely to have lymphatic issues, although that's not 100% the case in all situations, but more likely to have those issues. But yeah, basically your garbage system doesn't work and you get a backflow of garbage. It doesn't have anywhere to go, and so it deposits itself in the tissues so it can try to function and get rid of new garbage as it's coming in. But it's not an ideal system when it doesn't work properly. Okay, so signs of poor lymphatic drainage in the head and neck. You have facial puffiness or swelling, under eye bags or dark circles, sinus congestion or pressure, swollen lymph nodes, frequent headaches, jaw tension, ear fullness, acne, or skin congestion. So even if your complexion just looks rough. In your neck and upper body, neck tightness or swelling, feeling of pressure around the collarbone area, shoulder tension, puffiness in the upper chest or clavicle area. Whole body signs, water retention, swelling in the hands and feet or ankles. That's usually what people think about, specifically with lymphatic drainage. A lot of people don't realize that, they have a lot of these signs, but they don't recognize it as such. Feeling puffy or bloated, fatigue or sluggishness, frequent infections or cold, slow healing, brain fog, skin that appears dull or congested. You could see that in my first picture. That was how my skin looked. Lifestyle clues that may contribute: sedentary lifestyle, poor sleep, chronic stress, dehydration, and inflammation in the body. There's a couple more signs we're going to be talking about in some future slides, so I won't talk about those things. So one of the big things that can help with this is lymphatic massage. You can do this on your own. You can have a professional do this as well, but you can easily do this on your own. It can be done daily or several times a week. Lymphatic massage is very gentle, and it just really helps to move that stagnant fluid under the skin in order to aid in this detoxification. If you have a fat pad, it's going to take a little bit more work to be able to work through that. It's best done after you've done a sauna session or even just a hot shower. And you're just going to spend a little bit more time and do a little bit deeper strokes in that area. I do have another video on my YouTube channel about my lymphatic massage routine. You're welcome to go check that out. It's not a full head and neck lymphatic massage. It's mostly for the face, but it's a great starting point. And essentially what you're going to do is you are going to apply a clean ingredient moisturizer to your skin to help your hand or tool glide smoothly over the skin. You're going to follow a lymphatic massage routine regularly for best results. Hands work great, but you can also use a gua sha tool. And I've just got a little video here of what a gua sha tool looks like and how you might use it. This is just a stock video, so nothing really fancy here. There is a lot of information and videos out there about how to use a gua sha tool, but I personally really like using my hands. And lymphatic massage is not the only type of massage that is good for the face. I would highly recommend combining some kind of fascia release and muscle massage into your regular routine. We're going to talk about a little bit of those, but that can actually help with wrinkles, tension, pain, and fascial, not facial, but fascial adhesions. So we're going to talk about fascia, what that means. Structural and biomechanical health deals with muscles, tendons, ligaments, and bone, but one essential structure piece that is often overlooked is fascia. Fascia is the glue and the wrap that holds everything together in our body. Fascia is a continuous web of connective tissue that surrounds and supports muscles, organs, nerves, and blood vessels throughout the body. It helps maintain structural integrity, allows tissue to glide smoothly, and transmits force during movement. When fascia becomes tight or develops adhesions due to injury, inflammation, or poor movement patterns, it can restrict mobility, alter posture, and create compensations that affect both body structure and function. Fascial adhesions, so that's where it sticks together, can also restrict lymphatic drainage. So if you have fascial adhesions, your garbage system can't transport things as well. Fascial adhesions can also affect lymphatic and blood flow and nerve supply. It can also create wrinkles in the head and neck due to tension. Since fascia is one continual connection through the body, fascial tension in the feet can affect tissues all the way in the head and neck, and vice versa. Think of bunching the corner of a sheet on a bed. The sheet will put tension and wrinkles all the way across the bed to the other side. Fascial adhesions limit mobility and function all over the body. And fascia release is a gentle technique that helps loosen tight connective tissue in the body. By relaxing these restrictions, it allows muscles and tissues to move more freely, reducing tension and improving overall function. This can help with tension and wrinkles, as well as limited mobility and even pain. Stuck fascia affects all different layers within the body and not just in the muscles. So there are some manual fascial release techniques. You can get a myofascial release massage. There's cupping, rolfing, and craniosacral therapy. Those are just examples of things. That is not an exhaustive list by any means, but yes, there is lots of things you can do for fascia release. Okay, so we're going to go on to the next, We're going to go on to the next type, the low tongue posture type, chin. Again, you can see my pictures here. I am purposefully dropping that tongue low in my throat so you can see that, but I see this all the time on people. And I can literally look at somebody and say, that's a lymphatic type, and or that person has low tongue posture, just based on my experience with these things. So it's not really hard to spot. It kind of creates that almost like pouch right there in the corner of the where the neck meets the jawline, and it's very easy to spot. So what does it mean to have low tongue posture? So low tongue posture, or even low tongue tone, like the tongue is not very strong. This can be helped through myofunctional therapy. Myo is basically physical therapy for your mouth. The tongue needs to be trained to sit in the proper position, and what that proper position is it needs to be fully on the roof of the mouth. And when I say fully, that's really probably the front 2/3 of it. A lot of people think that they have their tongue up, and they often don't have it up far enough. And for some people, it's really hard to tell. So, yeah. So the benefits of proper tongue posture, this is a video in and of itself, but we'll just kind of quickly go over this. It supports proper nasal breathing. You want to breathe through your nose 100% of the time if you possibly can. That oxygenates the brain better. If we are breathing through our nose, it promotes better sleep quality, stabilizes the jaw and bite, supports healthy swallowing patterns, and improves facial muscle balance. And here's a few more. It supports facial structure and development as you are growing. That tongue actually helps make the upper part of the maxilla, so the upper teeth and the hard palate, wider. That's what we want. It helps maintain airway space, reduces strain on the head and neck muscles, supports efficient speech production, and encourages better overall oral function. So lots of benefits of proper tongue posture. And again, this is not even sort of scratching the surface, but this is all we're going to talk about right now. So how does the tongue tie it all together? And that is a little bit of a pun, but not totally. Let's see. The tongue is a powerful and highly coordinated muscle that plays an essential role in breathing, swallowing, speaking, and supporting the structure of the face and airway. When the tongue has healthy tone and proper resting posture, gently resting against the roof of the mouth, it helps support balanced facial development, stable jaw alignment, and an open airway. However, when tongue tone is low or tongue function is impaired, the body often develops compensation patterns involving the lips, jaw, and neck, and surrounding facial muscles. These compensations can contribute to inefficient swallowing, mouth breathing, jaw tension, and strain on the muscles of the head and neck. So the tongue does more than what most people realize. So because the tongue connects through the fascial and muscular chains to structures throughout the body, dysfunction in tongue posture and movement can also influence overall posture and muscle balance. This is very surprising to a lot of people. Over time, these patterns may affect facial appearance, including muscle tone, symmetry, and how the tissues of the face are supported. Proper tongue function supports healthy breathing, restful sleep, balanced muscle activity, and optimal structural support for the head, neck, and face. The tongue in a sense, holds the body up and together. Okay, so what is a tongue tie or tongue restriction? This is an important side topic here, because if we have a tongue tie, the tongue literally can't get up into the roof of the mouth, and then we end up with that pouch in the neck area. So you can see these are all pictures of tongue ties in this on the left, and there is a different varieties and different types and different levels, I guess is what I'm saying, of tongue ties. And it's important that we understand that not everybody's tongue is the same, and not all tongue ties are the same. So basically a tongue tie is tissue that constricts or is too short or too tight, and it limits the tongue's natural mobility, the mobility that it needs to do its job. So if your tongue is tied, it can't hold you up and support your head and neck the way that it should. Tongue ties can have a wide variety of side effects, and I see a lot of people that are adults and well into adulthood and don't even know that they have a tongue tie. A lot of dental professionals are not trained in tongue ties and how to see that. Myofunctional therapists are, a lot of dentists are, but I've seen a lot of dental professionals that don't understand it either. So yeah, but it leads to compensatory patterns in the head, neck, and body. And then over time, these compensations can contribute to muscle tension, inefficient swallowing, mouth breathing. Like there's a whole host of things that are downstream effects of a tongue tie. And it can also lead to some of the problems other problems we're talking about in this video: head posture, body posture, low tongue posture in the neck, all of those things. Okay, so I have this video in here. I'm going to show you this person swallowing. This is a pretty good swallow, but even how you swallow your food and your drink can be affected. How you swallow like 2,000 times a day. And every time you swallow, if you swallow improperly, you are creating issues in your head, neck, and as well as the body. So just a little plug for my business. My business is Core Body Integrative Health, and I do offer myofunctional therapy services. Again, you don't have to go with me, but if you are seeing some of these things from this video, you do not know what to do with it. I have a wide variety of services that I offer, but myofunctional therapy is one of those services. Okay, so we're going to talk about the forward head posture type. You can see in this little video kind of what happens to those muscles. Excuse me, this picture. You can see what happens to those muscles. And again, we're going to leave it as it is not ideal for the body to be moving in through space this way. This is actually my son. You can see he has a forward head posture in this picture. And the line that I have, the black line that goes from top to bottom, should be where his ear is. And his ear is quite forward of that. So you can see that. And he's actually corrected that quite a bit since his picture. But he's definitely, without changing anything, on a path to not good health in the future. Okay, and then again, this type ties into just the previous slide. This is the structural or biomechanical type. So we're looking at whole body stuff here. And the structure and function of the whole body is important. Everything is connected. Everything plays off of each other. Humans are literally basically a broomstick with a bowling ball on the top, a flexible broomstick at that, with a bowling ball on the top, and we have to stay upright. Everything plays into each other. It's all interconnected. When we do our pictures, we can actually take some assessments of the face and body, and we want to see what's going on. We want to see if we have asymmetries. We want to see what's happening and in order to try to fix what's going on. And appearance is function. If you have issues and you have asymmetries, it's going to affect how your body moves through space, functions, all of those things. A lot of times we go to the gym for our body, but we do not address the muscles of the head, neck, and face. And I think that's very important. Like I said, structure and function of the whole body matters to how you look. Your face shape can change if you walk a certain way, because of how things are interconnected and how things play into each other as you grow. If you get an injury as a child and you have some restrictions in your body and you can't, you don't have those fixed, then as you grow, you're going to grow, potentially crooked. And so it's important for us to pay attention to these things, not only as we're growing, because some of us are adults and we want to fix things now. It's important for us to look at things right now. And a quick note on the temporomandibular joint. It connects the jaw to the skull, and it plays a central role in chewing, speaking, and facial movement. So again, we're talking about under the chin and neck. This bone plays a very important role in that. Let's see, because it is closely connected to the muscles, nerves, and fascia in the head and neck, dysfunction in the TMJ can influence surrounding structures. Imbalances in the jaw joint may contribute to spinal misalignment, tension in the neck and shoulders, ear symptoms such as fullness or ringing, headaches, and irritation of nearby nerves. When the TMJ is not functioning optimally, the body may develop compensatory patterns that affect both the comfort and overall function of the head and neck. Issues within the joint itself can cause pain and poor functioning of the jaw. You can see on the left, it's a little bit of an exaggerated picture, but you can literally have asymmetries in your face if you have, like I said, depending on how you even walk. It's more complicated than that. That makes it sound very simple or like it only has one factor, but yeah, how you move through space is very important to how the body forms. All right, everyone, thank you so much for watching this video. I really appreciate that. I hope that you learned something. If you have questions, feel free to reach out to me. I am in the process of making more educational videos, and I hope that I can expand on some of these topics for some of you. But again, in the meantime, reach out if you have any questions, and if you'd like to start doing some of these things and you need some direction, I'm more than happy to help. Thanks, guys.